Hey there, I'm Susan Burke. I'm one of the clinical managers with the Rock Hill office of Bayada, and we're going to go over four in-services today for home health aides. Um, each one has a lot of really good information, and we're just going to hit the highlights of them. So I'm really going to encourage you to read through them on your own time and just kind of know that that information is not just for you as a home health aide for Bayada, but it can also be part of your wealth of information um, to use in everyday life. I mean, it may apply to people that you know, to family, to friends, people you encounter, and it's just good information as you interact with people throughout your life. So the ones we're going to go over today are going to be understanding diabetes. Looks like this. Let's see if I can make it. Can you see that? Understanding diabetes. We're going to do working with the clients that have intellectual disabilities. We're going to do understanding seizures and understanding neglect. So go ahead and get those four in-services out to be going over, okay? Each one of these modules should have a paper on the front that's an in-service record. I need you to go ahead and take that paper off. You're going to put your name up here. You're going to put the date that you're doing it, and down here you're going to sign it. I need each of these top sheets to come back to me, and then there's a quiz to come back to me. Don't send all the papers in between. That is your information. You can keep that for your records and your reference. But we do not need that back. We need just the in-service record to show that to indicate that you watched this video, and then the quiz. The other ones that you do at home that are not going to be on this, we just need the quiz back. Okay? So take that quiz off, or that in-service record off, and we look at, this is the one we're starting now, is going to be understanding diabetes. So if you look at the beginning of it, it talks about the facts for diabetes. Just know that diabetes is on the rise. It is affecting children, adults, seniors. It's just becoming a very big problem we're seeing throughout the United States and through the world in general. And other elderly patients, almost half of the ones that we see are diabetics. It increases the risk for heart disease and stroke. It can cause blindness. It can cause kidney problems. It can cause it leads to lower limb amputations. It also damages the vessels of the body, all your blood vessels. So what is it? We've heard the term diabetes for a long time, but what is it? Well, if you think about just the normal person, if I'm just sitting here and I'm talking to you, I'm just sitting at my desk and I eat a sandwich. What happens is that I eat the sandwich, it's digested, and in that process, it is turned to sugar. Call it glucose, but I'm just going to call it sugar for now, that the body will use for energy. And it's in the digestive tract, it is absorbed into the bloodstream. So now you have the sugar in your blood. You have your blood sugar. Then you have your body, a normal body, its pancreas will start producing insulin. Knows now that blood sugar's there, we got to take care of it. What are we going to do? Send out the insulin. It will send out insulin to pair up with that and help the sugar go into the cells for storage or to just let it be used. So I'm just going to say, if that sandwich gave me, this is purely an example, if it gave me 100 milligrams, check that, 100 molecules of sugar in my bloodstream, and my body produces, let's send out 80 molecules of insulin, okay? So what that'll do is it'll go into your bloodstream, and each one of those molecules of insulin will pair with a molecule of sugar, and together it takes both of them to go into the cell, okay? So I have 80 of the little insulins. They each pair up with one of those 100 blood sugars. We have 80 being stored for later. I'm going to leave 20 in the blood system kind of going through because I need a little bit of energy right now to talk to you, to breathe, for my heart to beat, for me to wave my arms around, to talk to you, all that good stuff. If I am a person that is not functioning normally that way, and I eat my sandwich, and it's converted in my digestive tract into the sugar, which goes into the blood, so now we've got blood sugar. Okay, let's say my pancreas is not working correctly. It's going to do one of a couple different things. It might not be able to produce enough insulin. It may try to produce insulin and send out 20 molecules of insulin, but you've got that 100 from that sandwich, that 100 molecules of sugar out there. So those 20 will pair up and go into the cells. Your body will use 20 for what I'm doing right now, but it will have 60 extra going through the bloodstream, which you'll find out as we talk, that's a problem. We also have the possibility that the pancreas is producing insulin, but it may not be functioning insulin. It might not be formed quite right and work correctly. They may produce those 80 insulin that come out and pair up with the sugar, but because they're not formed right and they don't work quite right, they can't get into the cells correctly. So now you have still all that sugar circulating through your blood. So that's kind of what's happening in the situation. So if we go into our packet, turn the page, oops, not enough staple. It says, well, what exactly is diabetes? That's kind of what I just explained. It talks about the types of diabetes. Well, type 1 is when a person's body stops making insulin. This usually happens at a young age. A lot of times before a person's 12 years old. There are people it happens when they're a little older, but can be known as juvenile diabetes. There's just something that's not working correctly, and the pancreas is not going to produce insulin, it stops. So now they have no insulin to take that sugar out. So this is a chronic disease. It can be managed. It's also considered an autoimmune disease, which means that the body is sort of attacking itself. Doctors aren't exactly sure what causes it at this point, but it can be managed. Then we have below that, it says gestational diabetes. Gestational diabetes occurs when a woman is pregnant and she starts to have the blood sugar issues during the pregnancy, which is usually temporary and will resolve after pregnancy, puts them at a higher risk for later on having diabetes type 2. But during the pregnancy, it can cause problems and be detrimental to the mother and the fetus, the baby. So that needs to be kept in check as well. And there's some risk factors down there too. It talks about it being over age 30, family history, diabetes, obesity. You can read through those. Then we look at the next page. It talks about prediabetes and type 2 diabetes. Now, type 1 and gestational diabetes, those were not ones that we really had that much control over. Prediabetes and type 2 diabetes we have a lot of control there. It's based on lifestyle choices, and we can usually prevent a lot of it. So, usually, if a person's diagnosed with prediabetes, it means that the blood sugar is high, but it's not outrageously high to where it would be in a diabetic range at this point. However, you're on your way. The symptoms sometimes can be very subtle. You might not even notice the symptoms, but it can be increased thirst, frequent urination, fatigue, and maybe you're having some eye changes, some blurry vision. Risk factors include being overweight, not active, having family history of diabetes. Let's see, I think it has different, it talks about being African American, Hispanic, American Indian, Asian American, or Pacific Islander puts you at higher risk. And if you have that gestational diabetes, you have a higher risk of getting type 2 diabetes. So anyway, if you get this diagnosis, it is not a life sentence saying, hey, you're going to become a diabetic. It can tell you if you make some lifestyle changes and you start eating better and healthier and watching sweets and getting exercise, that you can change that and you don't need to move on into the diabetes 2 category. So then if we look at this sheet, it talks about type 2 diabetes over here. Type 2 is the most common. Now I want you to look at all of those symptoms that are on here. It talks about frequent urination, especially at night, extreme thirst, feeling hungry even after you eat something, losing weight suddenly and for no reasons very quickly, vision changes, tiredness, especially after you eat, irritability, dry, itchy skin. The women often have frequent yeast infections, men have sexual impotence. Sores that kind of become very slow healing, increased skin, gum, bladder infections, tingling, numbness in hands and feet, burning pain, even if you feel that in your feet, changes in your skin, the colors of your skin, those are symptoms of being type 2 diabetic. And it does say, if left untreated, these symptoms of diabetes can become dramatically worse, including a coma. The breathing that smells like a nail polish remover, it's usually categorized as a fruity type smell. I don't really think so. It does, the nail polish remover is kind of a good expression of that. Deep sighing breathing. Then let's go on to the blood sugar. Is it too high or too low page? That says page 5. Hyperglycemia and hypoglycemia. Hyper means there's too much sugar. Hypo is not enough. So let's see. Hyper is usually when somebody's blood sugar is greater than 180. Why could that happen? Why would somebody have more blood sugar than they're supposed to? It can be that somebody is off of their schedule with their insulin. They're kind of messed up with it. They're not really paying attention. They're not taking their blood sugar levels, and they're just arbitrarily giving themselves more insulin. I've seen people trying to say, oh, well, I'm going to eat a piece of cake, so I'm going to take extra insulin now. That's not the way to manage your diabetes. You can end up getting hyperglycemia. You can have one of these problems. You can be eating more sugary foods. And this one usually takes several days to sort of build up. It doesn't happen super quick, but it is something that's a change over a few different days. Warning signs include fatigue, increased thirst, increased hunger, headache, dry mouth and skin, and blurred vision. Watch the blurred vision. If it's left untreated, it can lead to a diabetic coma. You want to get help. ASAP if you continue to have dry mouth for a while, if you start having nausea and vomiting, or you start getting short of breath. We don't mess around with breathing. Okay, if you start feeling breathing difficulties, that's a good sign to get in touch with the doctor right away, irregardless of what the issue is. High blood sugar can lead to nerve damage, kidney damage, damaged blood vessels, and eye disorders. We already talked about that. Hypoglycemia, that is when your blood sugar is too low. Usually thought of as being 70-ish, 70 or less. Why would a person's blood sugar get low? Now we've talked about how if you eat something, it makes it get high. How does it get low? Well, if you have an illness or infection, remember your body is going to use more energy to try to combat those issues, and so your demand for sugar might, not just sugar, but blood glucose might go up because of the demand for it for your body. So you could experience some low blood sugar. Skipping meals, if you took too much insulin, drinking alcohol, or if you're exercising more, like if you're moving or something on that day and you're exercising a lot. And this can happen very quickly. This can happen like you can see a person kind of go downhill pretty quick. Their symptoms are usually a weakness, they're drowsy, they're hungry because they need to have more energy. They need to have more blood glucose. Dizzy, pale, clammy skin, sweaty, irritability. If you think about it, some of that makes sense. Like, okay, you have no energy. Your blood glucose is low. The glucose is what's providing your body with energy. If it's low, of course you're going to be weak. Of course you could feel drowsy or dizzy, lightheaded, and of course you're going to be hungry. Pay attention to these symptoms. If one of your clients seems to be having some of these symptoms, it can be easy enough as giving them a few goldfish crackers or peanut butter cracker or something to that effect. If it goes untreated, you can actually, you can move into shock and you can actually die from it. So it is a serious condition. It is something that you can bring a person out of it pretty quick too. So just be aware. And you're going to want to get help as soon as possible if the person continues to have a severe headache. If the symptoms continue even after they've eaten, be sure that what you feed them is something that has sugar in it. Don't give them a diet soda. Don't give them sugar-free throat lozenges. Be sure it has something with the sugar in it. But get help also if they have a seizure or if their level of consciousness changes, their loss of consciousness. Now, let's go to complications, common complications. There's a whole bunch of them here, and it tells you what they are and how, what you can do to help your client or help yourself or whoever the person is reduce their risk for these things. They are heart disease and stroke, kidney disease, diabetic neuropathy, wounds that are slow to heal, amputations, diabetic retinopathy, and gum disease. A lot of things that it affects your body. You're going to want to pay attention to these things and read through all the different things that you can do to encourage your client to be healthier in their disease management. And how is it treated? First and foremost, if a person is diagnosed with diabetes, doctor is going to tell them probably you're going to need to lose weight or you need to get to a healthy diet, which is in this. It's on page 10. And then they're also going to say you need to get more exercise. It's going to help your body work and act more efficiently. If that doesn't work, then they'll probably go with oral medications. Metformin is one of the very first drugs that they use, and they have you take it a couple times a day. It's usually an extended release. A lot of times that works well for a lot of people. Then if it doesn't control it with the metformin, a lot of times then you'll have to go to the insulin. And insulin cannot be used as a pill. It is injected. And so there's different types of insulin. If your body's in need of insulin, you got to get it. So there's short acting, which will pretty much act right away. There's moderate, it goes all the way to long acting. It just depends on how your doctor sees that this is the best way to control your diabetes. They can have one of those pens that you dial the dosage on. They may have to draw it up in a syringe. Some people have an actual insulin pump, which is a little box that is usually somewhere on their abdomen. It has a little tube that they stick a place, and it actually gives themselves some doses of insulin. So let's see. I'm going to let you all read the part about the diet and then the controlling the diabetes with exercise. Let's go ahead and do the quiz. Okay, get out your quiz paper, pull it off so that you have it to go with your in-service paper. You're going to sign your signature over to the left, put your name and the date up at the top. It's on the left side of it. Okay. Number 1, diabetes is the leading cause of all of these. It's for lower limb amputation, kidney disease, and stroke. It's the leading cause of all of those. Number 2, which of these is needed to help glucose enter the cells for storage? B, insulin. 3, your client asks if it's okay to have a piece of birthday cake at her granddaughter's birthday party. You should tell her. C, it's okay to have a very small piece on this special occasion. If a person is following a healthy meal plan combined with exercise and only has occasional small portions of sweets like this, it is fine for them to once in a while partake. But that doesn't mean that a person that's not following their diet, not exercising, can go in there, have a big old piece of cake and ice cream. It doesn't work that way. They're able to have a small piece. And yes, you can tell them that. Number 4, the best test for diagnosing diabetes is A, the A1C. A1C test, it shows blood sugar over a span of several weeks. Number 5, people who take insulin are less likely to suffer from hypoglycemia, low blood sugar. Did I read that right? I'm sorry. 5, people who take insulin are less likely to suffer from hypoglycemia, low blood sugar. Actually, that's false. They're more likely to. Number 6, sorry about that. Most people have some ability to control their blood sugar with diet and exercise. That's true. That's true. 7, tingling, burning, or sharp jabbing pain in the legs may be a sign of diabetic retinopathy. That's false. The word retinopathy refers to your eyes. So if it's jabbing in their legs, it's actually referring to neuropathy. So the answer to 7 is false. Number 8, exercise helps the body use food and insulin better. That's true. Number 9, increased thirst and frequent urination are common symptoms of diabetes. That's true. 10, sugar is the only food that causes blood sugar to go up. False. False. Your body will change carbohydrates, things like that, into sugar about the time it hits your mouth. Okay, so that takes care of the diabetes one. Remember, I want the in-service record and I want the quiz. So let's look at the next one. The next one we will do together is working with clients who have intellectual disabilities. This one. Okay? Take off the in-service record. I need your name, the date, and your signature at the bottom. Okay. Let's open up the first page here of intellectual disabilities. Why did they change the name? This term, intellectual disabilities, became the term that has been used since 2010. Because before that, it was called mental retardation. However, the word retarded, retard, all that became slang. It was offensive to people. It was like calling somebody stupid or dumb, or it was a real derogatory, negative word. So in 2010, Congress decided that that was not the appropriate term to use. So now we use the word intellectual disabilities. Okay, turn the page. We're on page 2. What is an intellectual disability? Okay, an intellectual disability is characterized by significant limitations in both intellectual functioning and adaptive behavior, which originates before the age of 18. So all of those things have to happen. You have to have an intellectual functioning issue, which is usually determined by an IQ test, but what it is it's the problem-solving part of your brain. It's the ability to learn. It's all of that part. Adaptive behavior refers to the things people do to adapt to their environment, your communication skills, being safe, identifying dangerous situations, things like that. And it all has to occur before age 18. So all of those have to be in place for you to be able to have them considered intellectual disabled. Okay, then let's look at page 3. It talks about these causes of intellectual disabilities. Well, things happen prenatally, which is while the woman's pregnant. It can happen during the birth process, and it can also happen, something can happen postnatally, which means after the child is born. So If in prenatal causes, I'm just going to read those. We have infections like German measles, HIV, things like that can cause different intellectual problems. Drugs and alcohol, health problems that the mother might have, like we talked about, the diabetes. So trauma during pregnancy, if like the mother's in a car accident and has abdominal trauma, abnormal chromosomes. Best thing that the mother can do during her pregnancy months is getting good medical care and making sure the diet that she follows is good and avoiding drugs and alcohol while she's pregnant. Perinatal care, that's during the birthing process. What can happen to cause a disability can be premature birth, a lack of oxygen at birth, trauma to the baby's head at birth, or infections picked up during the birth. Best thing a mom can do is have good medical care during the birth process. Postnatal causes means after birth. Things like Array syndrome, infections, lead poisoning, injuries to the head, metabolic defects, and malnutrition. So what can you do to prevent it is the newborns need to be screened for metabolic problems and do things like using the car seats, helmets for kids that are playing on their bikes, stuff like that. Protect your children. All right, let's go on to the levels of intellectual disability. On this paper, these ones up here, the mild, most people, if they have an intellectual disability, fall into the mild area. I mean, it's like 85%. And then as you come down here, there are fewer people that have profound intellectual disabilities. Most of them fall into that one. And usually the ones that are in the mild category, people don't even know that they have an intellectual disability until they hit school age. And then they may need some little assistance, maybe some vocational or IEP programs that can help accommodate them. And they can usually function fine out in our world without assistance of somebody being with them all the time or something like that. Moderate, they can learn to talk and take care of their basic needs, and they can usually progress to a point where they can probably live in a halfway house or a sheltered environment, but they might be able to do some sort of a semi-skill type work. Severe and profound, these people, they often have physical difficulties. They have trouble responding to or communicating, responding to their environment. And those that are severe can help take care of themselves, but they need supervision. They both need supervision. So they fall into a tough spot. We want to look at the causes for these problems. Down syndrome is a one that we hear about. It's a genetic disorder. It's where they have an extra chromosome. And usually those people fall into the mild to moderate intellectual disabilities, and they can actually, oftentimes, a majority of them can function out in the world and live full productive lives they mentioned here. We have Fragile X syndrome. These people have an X chromosome that's abnormally susceptible to damage. It usually tends to be much worse for males than females, but they also have behavioral problems, some emotional problems, along with the intellectual disability issues. It says here that they are more hyperactive and anxious and have autistic-like behaviors. We have fetal alcohol syndrome. Now, know that fetal alcohol syndrome is completely preventable. Refraining from drinking, because I don't know, they don't know. The proverbial they, don't know exactly what is the best, amount, no amount, 1 glass a day, whatever it is to drink during pregnancy. If you don't drink any, then guess what? You're not going to have fetal alcohol syndrome. But they may have physical deformities, intellectual disabilities, learning disabilities, vision problems, behavioral problems. Autism is the other one. There are difficulties but people with autism, they have difficulty in these 3 areas. social difficulties, communication problems, and repetitive behaviors with an onset of at least one by the age of 3 years old. They can range from the mild to severe categories. So some of them can function very well. Some of them have a lot of difficulty. Okay, so helping people with intellectual disabilities. Please remember that people with intellectual disabilities can learn, and they should learn, and they should feel successes and feel happy about succeeding at things. So give them the chance. It's just real important for their psyche, because they're people too. And also remember that if you have a client that's maybe 30 years old, but you hear that they're functioning at a middle school level, that doesn't mean that they're thinking everything is like, oh, the problems and whatever, like a middle school kid. They're going to have had all the experiences of a 30-year-old, all of those 30 years of experiences that they can build from, but they're going to make decisions and things on that age level. So think of them as being more impulsive about things, not thinking things really through like you might as an adult or something like that. Just be aware that they've been around the 30 years. They tend to have short attention spans. You want to give simple directions. You may have experienced this trying to instruct a child to go clean their room. That can be a huge undertaking for a child to look at their room, and it's a humongous mess, and they have no idea what to do with it. Don't have any idea how to start. But if you tell your child, pick up all the dirty clothes and put them in this basket, then they can go around the room and pick up the dirty clothes and put them in that basket. And you can say, okay, go pick up all the Barbies, put them in this tub. They'll go around the room and pick up all the Barbies and put them in the tub. You can kind of get them to do things by breaking it into small pieces, break it down for them where they can understand and where they can actually feel like, I can do this. So use simple, clear language, keep your sentences short, and be patient. This is really important. And don't just try to communicate. If you ask them, how are you doing today? And they don't answer right away, don't try to fill their head with answers. Give them a chance to formulate that, because sometimes they're going, they ask me, how do I feel today? How do I feel today? How do I feel? So they're thinking it through. Give them a chance. Think it through a little bit, and they can answer back. If you ask them, do you want a sandwich for lunch? And then they don't answer right away, and you say, or how about a bowl of soup? Oh, we can fix some chili. And you keep giving these things they can't even think through and sort. Do I want a sandwich? Well, maybe, but now we've got soup. Oh, soup. Would I rather have soup or a sandwich? Give them a chance to answer. Be patient. Be very patient. Help them with their success. Okay, we did that page. Okay. Watch your clients carefully to keep them safe. People with intellectual disabilities tend to be very trusting, and not necessarily do they identify dangerous situations. We have a client, or had a client, that I had on his care plan specifically. If you take him out to like Walmart or something, to be wary of strangers, because sometimes they're trying to take advantage of him. And he tried to manage his own money and things like that. And so people will target those who they may identify as a weaker person than them, and so they could confuse him and make off with his money. So just be aware that they may not be making sound decisions, may not be able to understand that this is a dangerous situation. It's a good fact to know. Nearly 1/2 of all intellectually disabled people are overweight. This is true. They tend to know, they like certain things, they want to eat certain things. You want to encourage a balanced, low-fat diet. Now, if you say, hey, do you want a carrot or do you want a Twinkie? You probably know what's going to come back, and you want to give them choices. But something you might do encourage this is, why don't you say, you know, I have a couple of oranges. Let's sit down and peel them together. Could give them an activity. They may enjoy doing that. And they may be eating something healthy. You know, just try to redirect that behavior a little bit. Encourage the balanced low-fat diet. And also encourage activity. A lot of times people, it's too hard to go take a walk. I'd rather just sit here and watch TV. Make it fun. You know, you can do things like you can bat a little balloon around. You can walk up and down the stairs of the house. You can roll a ball, bounce a ball, stuff like that. And they can have fun. They can experience successes and laughter and have a really good time. Okay, I think that's pretty much that. To give praise for good behaviors. So many times we often say, no, don't do that, don't do that. Oh, don't do that. No, don't. Catch them doing the good things. Say, that is a really great job. Oh my gosh. You know, get real excited for them. Give them control over their own lives, so you can kind of give them choices. Give them time to do things that they're good at or things that they enjoy. Let them have some good positive successes during the day. Like if you know they like music and they get to bob in their head, and you can say things like, wow, you've got great rhythm, you're an awesome dancer, and they'll get excited, and let them enjoy their time with you too. Know they have the short attention span, so you might have to redirect them. And something that's also real important to know is that sometimes working with people that are intellectually disabled is very, it can make you weary. It can make you tired. It can make family members, the caregivers, it can have them burn out. And you, as the home health aide, if you're doing this day in and day out for somebody, you can become tired. I don't want you to suffer burnout. Let us know how you're feeling at the office. Let's see if we can work with you, figure out what, you know, like if you need to take a break for a little bit or go one less day a week and get somebody else. Let us work with you, because if you're going above and beyond all the time for these guys, they love you, but we want to take care of you too. I want you to know that they want to fit in just like anybody else. Like I have a client that he goes to an adult day program. He wants it to be like everybody else and doesn't want to be thought of as somebody that has to go to an adult program. He wants you to call it school. So when I go by his house and I see him, I ask him, hey, how was school today? And he's much more receptive. It makes him feel better because he wants to fit in. Let's see, what else? Oh, on this page, the myths, I want to point out that number 3, it says people with intellectual disabilities should not enjoy sexual relationships. I want to point this out because it'll come up on the quiz. People with ID have the same needs and desires for intimacy as anyone else. Further, they have the same rights to be involved in a sexual relationship if they choose. And they do. And number 5, people with intellectual disabilities cannot learn. That's totally false. They can learn. All people can and do learn, and so just know that it just may take a little longer and some patience, but they can. So let's go ahead and do the quiz. Quiz. Remember, put your name, the date, and then where it says employee signature on the left, be sure you do put something in all of those places. Number 1, to be diagnosed with ID, all of these signs must be present except B, mental illness. They're not mentally ill. They do not have schizophrenia. They do not have bipolar. They have an intellectual disability. Number 2, intellectual disability can be caused by any condition that impairs development of the brain. D, any of these, during, before, and after birth. Number 3, most adults with mild ID, intellectual disabilities, C, can live and work in the community. 4, most people with ID have symptoms that are considered A, mild. 5, nearly 1/2 of all intellectually disabled people are overweight. That's true. 6, people with ID should not be allowed to have sexual relationships with others. That's false. They have the same rights as everyone else. Number 7, a person with an intellectual disability is unable to learn new skills once they become an adult. That is false. They can too learn. Number 8, people with ID tend to be suspicious of others and are not likely to talk to strangers. That's false. That's false. They're too trusting, and it can lead to them being in unsafe situations. Number 9, mental retardation is a perfectly respectful clinical term commonly used today. That's false. It used to be, but it's now intellectual disabilities. And some people may say mental retardation, and they don't realize that it's a slur. They don't, not everybody knows every little rule that Congress passes and stuff. Just know that now that you know that it's considered the proper way to speak of it is called intellectual disabilities. 10, intellectually disabled people have the same rights as everyone else. That is true. Okay, quiz and in-service record, please. Okay, so what have we got? Understanding seizures. Let's do that one next. Understanding seizures. I want the in-service paper, name, the date, and your signature on it. Okay. Let's try to move on through this one. Understanding seizures. Well, let's look at the first page that will come over here. It says a firecracker factory. This kind of gives it gives you a little scenario, and what it actually is a seizure happens when a burst of electrical activity causes a chain reaction of cells in the brain to overreact. So a little boom of something excitable up there in the brain causes everything to kind of go woo, kind of go haywire for a little bit, as a ripple effect. So we go to the next page. It says, what's really happening? Okay, and that's just where it talks about the neuron itself. If there's a burst that happens, usually it'll travel down a pathway, and it'll go through the cells and go through a normal process of your body. This is just when too much sort of scrambles around and goes in the wrong directions and everything, and it doesn't go, things don't go in the right pathway for it. So some people are born with seizures. Others develop them after a head injury or a brain tumor or a stroke, so after there's some sort of injury up there. Also, other things that can affect and make you have seizures are heart disease, fevers, alcoholism, and the use of illegal drugs. And just something to note here, it just says, sadly, while most seizures are caused by some type of brain injury, the seizure itself can also cause injury to the brain. We'll talk about that, but if somebody is having prolonged seizures, things like that, we need to get them medical attention as soon as we possibly can. Note that epilepsy is usually diagnosed after a person has had at least 2 seizures. So 2 of them that are not in conjunction with a known cause, like alcohol withdrawal, or like if a child has a fever and it's been way up there and they're having seizures related to that. I think that you all should take a peek at page 3, the terms. A seizure is a sudden discharge of electrical activity in the brain. It causes changes in behavior, consciousness, or perception. An aura is a feeling, it's a warning sign, just like it says there. It's something that kind of, the client knows that something is about to happen. They can tell, sometimes it's like sometimes it could be like their vision changes a little bit. I know somebody that tells me they have a blue feel, things look a little bit blue or something. It may be a smell, it may be a ringing in their ears, but it usually happens right before the seizure. A neurologist is a doctor who specializes in the disorders of the brain and nervous system. Partial seizure is a seizure that involves only one part of the brain. Generalized seizure is a seizure that involves the entire brain. Absent seizure is a very brief seizure, very short, and a lot of times the person doesn't even know they're having it. Basically, they could be doing something and all of a sudden they just stop and they can stare blankly for a second, and then they go back to what they're doing. Then they also have the tonic-clonic seizures. These are the ones people call grand mal seizures. A lot of times it's that stiffening of the body and the jerks and the spasms. And then we have a status epilepticus, and that's a seizure or series of seizures that lasts longer than 5 minutes, and it can be a life-threatening situation. It requires immediate medical intervention. Okay, let's look at, well, the types of seizures. We mentioned them. The grand mal is the tonic-clonic, and that's that one where they can stiffen, they spasm, they can jerk. It can be whole body convulsions. So it has different presentations, but it's very disturbing to see. We'll talk about what to do in a little bit. Absent seizures, we talked about that one where, they have the vacant stare. The myoclonic symptoms include jerky, sporadic movements, usually on both sides of the body. Okay, so what happens during a seizure? I like this page. There's a trigger. Sometimes we can determine what the trigger is, sometimes we can't. It can be, as here it says, it can be anything from a stroke to a change in the body's hormones. I have a client that she's prone to seizures during her period. The other 3 weeks out of the month, she has maybe one a week or something, but during her period, she has, a couple a day. It can be things like, I know of one that has, if the sun is coming in a window and it's on her face, then that bright light will cause her to have a seizure. Suddenly startling them, like if you go in the morning and say, "Wake up, sunshine," or make a lot of noise when you go into a room, it can suddenly throw them into a seizure. It's good to know what the triggers are, so if you can identify them, you might be able to avoid them and save you and your client, especially, a lot of issues, trouble. Okay, number 2 comes the aura. So the trigger happens, and then sometimes the client can identify an aura. And it says here, it's a warning sign. It can be like a ringing sound, a specific smell, a vision problem. If a person can identify it, if they know that this is their aura, they know it's coming on, they know they're going to have one, they can lie down, they can get in a safe position sometimes. The seizure starts. So this is when the seizure activity begins. It might be just that blank stare or an absent seizure. It could be all twitches and convulsions. Then after that is a post-ictal phase. Post-ictal is where they finish the seizure, but they need to return the body to normalcy. So somewhere in there, it may take, they may be exhausted after convulsing on the floor. Sometimes they'll need to sleep it off for a while. Sometimes the absent seizures, sometimes they go back to doing what they were doing. So it's like such a minuscule post-ictal stage. But anyway, it can last anywhere, it says maybe short, or it may take several hours. Then number 5, it says re-entry. That would be if the person goes into another seizure. And that's when they don't go through that post-ictal stage to where they can return to that normalcy, but they just go into another seizure. And sometimes that's what they do, and there's medications for interventions and different things, but we want to try to keep them out of that, poor things. Something more about triggers. It talks about other things like stress, hormone changes, lack of sleep. Like I said, if you can identify them, then you can avoid them. Seizures in seniors. There are more people having their first seizure at age 65 and older now. More people are living with more health problems longer into life, and all kinds of health problems can cause seizures. Some of them are stroke, dementia, brain tumors, head injury, liver disease. Some people think liver is down here in the belly and you got your head up here. Why would the liver have anything to do with it? The liver clears toxins out of your body, and if it's not able to do its job, if its functioning gets worse, you're having liver disease, you're going to have more toxins in the brain. Guess what? Stuff up there can make you have a seizure. Heart disease. If the heart's not pumping enough blood to provide oxygen to the brain, you can have a seizure. Alcoholism. It's usually during withdrawal that they have seizures. Uncontrolled diabetes. We talked about diabetics having having it because it affects the nerves. Guess what? Brain's full of nerves. Infections in the central nervous system, reaction to prescription drugs, kidney disease, kidneys remove waste. They don't do their job and the waste going up in the brain. So all of those things. Let's see. Okay, how are seizures treated? Medications. Pretty much they need to take each dose of medication on schedule. A lot of the side effects of medications are listed right here. Read through those. If you see your client having, some of those issues that might be related to the medication. But the ones to report, and please don't be afraid to report things to the office. We need to know what's going on with the clients. You all are our eyes and ears out there. If they have blood in their urine or stool or dark colored urine, or if they're having pain or sores or purple spots on their skin, just let us know, please. Okay, let's see. What else? Here's what you need to know if a seizure happens. Person starts having a seizure. You want to get them as low to the ground as possible. If you can gently get them down to the ground where they can be on the floor, where they're not hitting things, and they're not going to fall. You can't fall from the floor. You're already down there. So you're less likely to get that they'll be hurt. You can cushion their head. Please turn them on their side. If they have any sputum, anything that comes up, we want that to get out. We don't want them to choke on it and them to aspirate it. Don't put anything in their mouth. I think that it was old school that people said, oh, they're going to swallow their tongue and try to hold it down with a spoon or something. Don't do that. They can choke on your spoon. It's impossible to swallow your tongue. It's already attached. Make sure they have plenty of room, that it's not dangerous. Don't restrain them. If the person is confused or agitated, a lot of times if you try to restrain somebody, it'll make them worse. Try to redirect them or guide them away from whatever might be harmful. Stay as calm as you can. It's very unsettling to see some of these things happen. Just be calm. Watch the clock. When you see something like this start, eyeball the clock, see what time it is. Remember, if it goes like 5 minutes or close to 5 minutes, we want to start getting help. But little ones, it's just kind of, that may be what is normal for that client. We would have told you. You would have gotten that information up front. Here, I want y'all to review this part here. It says, when is a seizure an emergency? If it is the first seizure ever, there's no history of them ever having a seizure. This is something new that's an emergency. If it's lasting longer than 5 minutes, if they're having more than one seizure without regaining consciousness, more seizures than normal. So if there's a change in what that you usually see from them, either in type or how long they're going on, or how many of them. If they have an injury, get help. If the seizure occurs in a bathtub or a swimming pool, because they could suck in water at some point during the seizure and they could aspirate. And if normal breathing doesn't resume. Remember, I said I'm all about the breathing. We have to breathe. So if there's any problems with breathing, we're going to get help. Read through the safety safety things here. This one about the clients. They shouldn't be locking the bathroom door when you're there anyway. I don't think there's really any reason that they should. You're there to help with their personal care, and they should not be locking. Encourage them not to lock the door. Tell me if they're having a problem with that. Tell your clinical manager. Because if they were to have a fall, if they have a seizure, things like that, we need to be able to get to them. But just kind of read through those. Those are all good tips. Lifestyle changes, family, people should know how to respond. You can read through the rest on your own, but let's go ahead and do the quiz. Okay, quiz. I need this attached. I need your name on it, the date, and your signature. Number 1, if you witness a seizure, you should. All of the above. You want to keep track of how long it is, help the person lie down on a flat surface and remove any dangerous objects near the person. 2, the feeling that serves as a warning sign that a seizure is coming on is called an aura. 3, during the post-ictal phase, you should help the client rest and let the body recover. 4, in the postictal stage, you also call us and report it. Number 4, the postictal phase can last from 1 day to as long as 1 week in an elderly person. Yes, sometimes it takes them a long time to recover. 5, anti-seizure medications are only taken just after seizure. No, that's false. Meds are taken on time every day to kind of prevent the seizures from happening. Number 6, you should place a spoon or a washcloth in a person's mouth during a seizure. False. No. Cause choking or hurt their teeth or something. Number 7, all seizures are emergency and require hospitalization. False. 8, an elderly person who has a seizure is at risk for head injuries and broken bones. It's true. 9, most people have their first seizure after age 65. This is true. Seizures in the elderly are on the rise. People live longer with more health problems. Number 10, fill in the blank. Status epilepticus is any seizure that lasts longer than 5 minutes and is considered an emergency situation. Okay, people. I need that quiz and in-service record. We have one more. Everybody, okay, get out Understanding Neglect. This is a very interesting in-service to read. It gives you a lot of scenarios that it can be heartbreaking. I'm going to read the first one. I'll read it quickly, but it's an extreme case of neglect here. But there's a lot of little ones on each page, and it's just very interesting and informative for you to read those and kind of understand that some people had no intention of being neglectful. Okay, an extreme case of neglect. Rosa had multiple health problems, including diabetes, kidney disease, heart disease, and dementia. Despite the difficulty of her needs, her 2 daughters convinced her and the rest of the family that they could take care of her and avoid placing her in a nursing home. Because there was a lack of family and community involvement, Rosa's care went unmonitored for months. When someone finally tipped off the police to suspicious activity in the home, Rosa was found strapped to a urine-soaked bed in the middle of a rundown living room. Her toes had been completely eaten off by rats and wild cats. Police reports that there was an overpowering smell of urine and holes in the floor where rats and other wild animals entered. When the police questioned one daughter about Rosa's toes, she said her mother most likely didn't feel the bites because she had hardly any feeling in her lower extremities. She admitted that rats and other wild animals often made their way into her trailer home. Further investigation found that the daughters were using Rosa's Medicaid and Social Security benefits for their own personal use. They were not taking Rosa to scheduled doctor's appointments or giving her prescribed medication. When Rosa was transported to the hospital, the nurses estimated that Rosa had not been bathed in months. Her hair was matted, and she had multiple bed sores on her back, bottom, and legs. Rosa died from complications of pneumonia a few days after being removed from the home, and her daughters now face charges of criminal neglect. That's so sad. So what is neglect? Their definition here says neglect is when someone fails to do things that are necessary to meet the needs of a child or an elderly person. I also want to include in that people that can't do for themselves, like the intellectually disabled people. Some of those people that can find themselves in neglectful situations as well. There's passive neglect, which people don't mean to do the neglect, but just kind of out of ignorance, not knowing any better, that they do neglect the person. And then there's active neglect. It's when a person knows good and well that they should do this, but they don't. Examples of neglect, some things you want to keep an eye out for are pressure ulcers, contracted muscles, dehydration and malnutrition, abandonment, safe or unsanitary living conditions, wandering, or untreated health problems. There can be domestic or institutional neglect. Domestic is when it's happening in the home, and institutional is when it's happening in a facility. It says, okay, we're going to look at pressure ulcers. Tells you who's at most risk. Is it elderly, poorly nourished, heavy, very thin, immobile, bedbound, paralyzed? All those people very easily could develop pressure ulcers. I was working in a rehab hospital, and a woman came in from having been in a nursing home that was being charged. She had actually a pressure ulcer on the back of her skull, and that was basically from her lying. She had other pressure ulcers as well, but I'd never seen one on the back of the head before. But it was simply because that pressure, she had not been turned or anything, and you could actually see her skull in there. It was one of the saddest. It was just so sad. It was just something simple, like just not turning her. Okay, it says in the gray box here, know the stages. I really want you guys to be very attentive when you're doing your personal care with clients and bathing them. Be alert to their skin and conditions that, and just changes in their skin. Early signs of a pressure sore can be like pale skin or a slightly reddened area over a bony area. And sometimes they'll say, oh, it really hurts. It really hurts, like the area, a lot of times right above their butt crack. A lot of times that's where a real common place, it's on the coccyx. It's where they develop a bed sore. And a lot of times they'll tell you it hurts. It hurts before it actually becomes where it's broken through the skin. Please report it. It talks about contractures. Contractures are when due to immobility, the muscles and the ligaments, tendons, things can shorten, and then they physically can't stretch out and move them because there's no give in that ligament. It's now fixed at that length. So they become shortened and permanently in a flexed position. Most common sites of contractures in the elderly are, it's like all the joints. All the joints. Know the warning signs about it, kind of all that. If they're hard to, when you go into the home, I've already assessed them and I'm seeing, and I'm doing my visits and so are the other clinical managers. If you're new to a client and you're seeing things that you kind of, the care plan doesn't quite coincide with things, please just go ahead and report it. It's not going to do any harm if you call and say, hey, I haven't worked with Mr. So-and-so before, but his right arm is really in a fixed position or something, and I just had some trouble dressing today. I just wanted to report that. Please, just feel free to call and let us know. If you see changes over time, if you work with them a long time and you see changes, let us know that too. I mean, there are simple things. If you see that, like sometimes their hands get real contracted, and if they hold them like this, sometimes they can develop yeast and dirt and stuff gets caught in there. It can smell really bad. Sometimes they keep their hands up like this, and we can't cut their nails, but if you see that they're grown and it's all contracted, and it's become a problem. It's neglect. We need to get that taken care of. Please report it. Simple things like range of motion exercises. If you have it on the care plan and it's appropriate for that client, we can add it to the care plan. But they're gentle stretching. You do not ever force during that range of motion. If you need somebody to come out and work with you on how to do it best for this person, we never force it. We just kind of go, like if you isolate a joint, you'll bend it back and you'll bend it forward. But you will not force it and try to hurt. It is painful for those people that, if you try to force something and it's not going to give. Okay, dehydration. A lot of times elderly people, as we age, we lose our ability to know when we're thirsty. A lot of people, when they get older, do not like to drink fluids. Encourage fluids. Unless, now there's always an exception somewhere along the line. Sometimes, and it'll say it on the care plan, if a person is on a fluid restriction for whatever their health condition is, more than likely, that person needs to be encouraged to drink fluids. Otherwise, it will be on their care plan. They may not feel thirsty, but just kind of sips throughout the day. Big thing that you guys can be thinking about is decreased urine output. It may be good in your mind that you're going, hey, I'm here for 12 hours and I only have to change one soiled brief because they're not wetting very much. That's not a good sign. Let us know if there's decreased urine output. Let us know these things. Let me know if if the urine's really dark, if their mouth is dry and sticky, if they're having any trouble swallowing. You can read over these things, but please just be aware that people need to have their fluids. They can have muscle weakness, a headache or dizziness, confusion. Read about the little scenario here. Good information. Abandonment. Now, I do want to take a minute to talk about abandonment a little bit. Abandonment of family. It's when you intentionally leave a helpless family member alone. A helpless family member is left alone. That's abandonment of family. Abandonment of a patient as a healthcare worker has already begun caring for a patient and then suddenly leaves while the patient is still in need without making sure someone else is available to take over. Abandonment of patient is a crime. Examples of abandonment, read through those. I'm going to read two of them here. A home health worker who does not report for an assignment where he or she is the sole caregiver. If you don't call in here and say you're not going to be there or whatever, and that person is, I mean, honestly, we have it on two counts. The family member, if they're leaving to go to work, if they leave before you get there, that's an abandonment issue. If they leave and then you never showed up, we have abandonment on both y'all's parts. Abandonment is a crime. A healthcare worker who falls asleep at any time during the shift and is unavailable for patient care. We do not allow our clients, I must be getting tired of all these in-services. We don't allow our staff members to sleep on their shifts. You need to be available for the client. You need to be alert for the client. If you're there for an overnight shift, you need to bring something that's going to keep you attentive, whether it's a book to read, whether you're making out your grocery list or your to-do list for the next day, or you can make lists like Christmas present lists, or I don't know, just you need to come up with things that are going to help you stay awake during your shift so you can be alert for your patient's needs. Because that is what it's in here, and it's considered abandonment. Okay, unsafe and unsanitary conditions. All of these things pay attention to. Unsafe living structure, holes in the walls or roof, visible dirt, dust, grime, or food buildup on floors or tables, mold, rodents, fleas, lice, roaches, and other insect infestations, strong odors of urine, feces, or body odor, pet waste. Limit or no access to clean linens or clothing, no access to drinking water or electricity. Proper safety features lacking, like ramp and stair rails. It's not a safe situation. You need to let us know. Okay, so about wandering. The most dangerous form of wandering is elopement, which is the confused person leaves an area and does not return. We had a client that actually this happened with, not on our shift, or when she was with some other caregiver or something, that she went walking down the street went in somebody else's house, when the refrigerator started eating somebody else's food in somebody else's house. Okay, there are two types of wandering: goal-directed wandering and non-goal-directed wandering. Goal-directed means that they have a need, or they have some things on their mind, that they have intention of getting somewhere to do something. Maybe in their mind, oh, it's 5 o'clock. This is the time my husband usually comes home, and they start wandering around for some reason, kind of, it has to do with some memory that they had. Or maybe they have to go to the bathroom, and they get up and they're feeling that pressure in their bladder, and they're looking for the bathroom. They don't really know what the reason is, but they're looking. So that's goal-directed. Non-goal-directed is when they have very short attention span, and then they just start wandering because this seemed kind of bored over here, so now we're going to go over here. Just kind of wandering around. They can be redirected pretty easily. Let's see. Talks about the different risk factors, and you can know your warning signs. You can see like if they're getting anxious or worried. Sometimes they pick at their skin. They might start pacing, things like that. The best thing you can really do is you want to keep your people safe. You want to, if they're wandering around, make sure their pathways are clear. Make sure that there's not things that they can get hurt on. Walk with them. Try to figure out what they're walking around for. If they have to go to the bathroom, help them go to the bathroom. If they're hungry, maybe you can redirect them with a snack, or maybe they really are hungry and go get something to eat with them. Go, I don't know, you just kind of, if they're agitated, I can guarantee if you try to restrain them, try to do something like that, it's just going to get worse. It's better to go with them, redirect them, things along that line. You can prevent neglect. Read through those things. Preventing the pressure ulcers. You are our eyes out there as far as their skin goes, because you're doing personal care. Somebody it's not mobile, you need to reposition them every 2 hours. Even if it doesn't say so in the care plan, that's just going to be what we're going to say, common sense on that. You want to be sure that they're moved around a little bit. You would not want to be in the exact same position for more than 2 hours straight. Check their skin, make sure they're not being incontinent. Keep their skin clean of urine and stool. Floating heels. It says place heels off the bed. If you've ever worked in a facility, I'm sure you've heard the term float heels. The back of your heel, if a person is in bed, is a very common place to get pressure sores. You can put a pillow under their calf so that their heel is dangling off and not touching the bed, and that will prevent a pressure sore or pressure spot. So it's a good idea to float their heels. You want to prevent dehydration. Encourage drinking fluids. Prevent abandonment. Never leave a client unattended. Read through these. These are going to protect you. Report any unsafe, unsanitary conditions. Prevent wandering. Promote safe movement. Let's do the quiz. Ready? Let's do it. Get it done with. Number 1, you know your client has a soiled diaper, and you know you need to change it, but your shift is ending, so you have to leave. You may be accused of, guess what? A, active neglect. You know what to do, but you failed to do it. So, there you go. Number 2, your client holds his hand in a tight fist and fights you when you try to open them to clean his palms. You report that he may have C, hand contractures. This is not a behavioral issue. The contraction may actually hurt when you try to open those fingers up, and it may hurt him. Or somebody else may have tried to do it and he just remembers that it hurts and he's afraid you're going to hurt him. Report that. Try to clean it as best you can, because it gets very filthy in there, but just be aware that some of those fingers may not move. 2, no, there's 2 number 2s on here. Okay, the second number 2, a client who wanders may be all of these. They may be anxious, in pain, frustrated. You can kind of follow up on that and see which one you think it might be. The real number 3, the one that's marked 3, you notice a slightly reddened area on your client's heel. The skin is cool to the touch and your client tells you it's tingling. You should report your findings, which is D, and make a detailed note in the chart. Not only should you do that, but you should move the position. You should alleviate the pressure. Don't massage it. Massaging it can make it worse, but just keep the heel so where nothing's touching them. Be sure to report it. 4, neglect can be harmful, but is not a crime. False. It is a crime. 5, elopement is when a confused person leaves an area and does not return. True. 6, a key sign that a client may be dehydrated is rapid weight gain. False. It's loss. Also, low urine output, confusion, headache, those things. 7, bed sores and contracted muscles are physical evidence of neglect. True. 8, the best way to prevent wandering is by using restraints. False. Never try to restrain them. Try to figure out why. Offer safe alternatives. 9, you do not have proof of neglect to make a report. You do not have proof of neglect to make a report. Whatever. Um, I'm reading it wrong. I'm really tired. I'm sorry. You do not have proof of neglect to make a report. That's true. I mean, you do not have to have the proof that something's going on. If you suspect it, please tell us. Please, we'll make a report. Number 10, if your client refuses to drink, you should force him because you could be charged with neglect if he becomes dehydrated. False. We're going to respect that person. We're going to encourage, words encourage fluids. You know, get it there, get them little sips, put the straw there. We are not going to force them to do anything. But if they are not drinking their fluids, protect yourself. Go ahead and report it. Call and say, you know, I was there for 6 hours a day. Mr. Smith didn't drink a thing. He refused it the whole time. Tell the family. Put it on the document on that place on the little lines on the timesheet on this date, 12, whatever it is, and a client did not drink any fluids during shift, and then who you reported it to. Protect yourself. Okay, that was the last quiz. Yay! Put your employee name, the date, and your signature on that sheet. You should have 4 quizzes and 4 in-service records. I want all of those materials into the office as soon as you possibly can get them in. I know that I've been talking and talking and talking, and I appreciate you all doing your listening. Thanks so much, you guys. Take care. Call me if you need anything or have any questions, all right? Let us know. Take care. Bye.